family history, allergy, and social. So 1, 1, 1, 2, 2. So 7 mark or 8 mark we lost. And this is the main problem face our candidate who's entered the exam. He lost a mark, he reached the diagnosis, but he lost a mark because he found that to ask about allergy or family history or social history or other system like heart, chest, urinary, whatever is not of value. So he lost a lot of marks. This is a common mistake. So just don't lose the time. So we start the first scenario. Scenario is written like this, and I will ask one of you just to start to chat with me as a simulated patient. So the scenario is 55 years old male, severe epigastric pain radiated to his back, and after attended daughter wedding, and he drank a lot, 9 cups of alcohol. He's usually drink, but a small amount on the weekend. He is married. This patient is married and have 2 children and live with his wife. Okay, so any volunteer after that we give comment for him. Anyone? So Dr. Agamiya, you can start. Fadi, you can start.
I start taking history.
Yes, can. I am the simulated patients. You can take a history.
Okay. Okay.
So I
Good.
count you 6 minutes, so you can start, or 7 minutes. You can start. Good.
Okay. Good evening. I'm Dr. Fadi, one of the surgical doctor. Could you confirm me your name and age, please?
Yeah, I am Mr. John. I am 55 years old.
Okay. Nice to meet you, Mr. John. Today, I have been asked to ask you some questions about your condition. Is this okay with you?
Yes, can.
Okay. I will take some notes while I am asking you. Is this okay?
Okay, can.
Okay. How can I help you today?
Okay, I am okay. I just yesterday I have my daughter wedding and I drink a lot of alcohol and I have severe pain. So I called the ambulance and they bring me to the hospital.
Okay. I'm so sorry to hear that. How do you have the pain? How do you have pain?
Uh, yes, but the doctor gave me medication, so no pain now.
Okay, that you are comfortable now.
Yes.
Okay, that's okay. And that does the pain? Is there anything make the pain increase?
Uh, if I moving, the pain is increasing. If I drink or eat, the pain increasing.
Okay, anything make the pain decrease?
Uh, just sit in the bed, but if I leaning forward, the pain decrease.
Okay, and about the pain is radiating to another area?
Yes, it is related to my back.
Okay, could you describe me the pain, please?
What you mean by describe the pain?
Is it
You mean
cramping
character?
pain, dull aching pain, sharping
No,
pain?
it is dull aching pain.
Okay. On a scale from 1 to 10, could you score me the pain as the 1 is the lowest and 10 is the highest score?
It was 7, now become 3.
Okay. Could you tell me when the pain start exactly?
It is in the front of my abdomen and radiated to my back.
When and when? When did it
No,
start?
it is just yesterday when I was in my daughter wedding.
Okay. It was gradually or it started suddenly?
No, start suddenly.
Okay. It was continuous or come and go?
No, it is colicky. It is on and off, intermittent pain.
Okay. Thank you for sharing us these details. Do you have any pain going to the arm or your back only?
I know only to my back.
Okay. And you told me that leaning forward make your pain decrease. This is right?
Yes,
And drinking alcohol make your pain is increasing. This right?
yes.
Do you have any vomiting?
No vomiting, but I have nausea.
Okay. And do you have any diarrhea?
No diarrhea.
Okay. Do you feel any acid taste in the back of your mouth?
No,
Any heartburn?
no,
Does the pain go to the right shoulder?
no,
Any fever?
no fever.
Any change in your urine?
What you mean by change in my urine? You mean
When you go to
frequency,
the
color?
loo,
Oh,
when
yes.
when you go to the loo, do you feel any change in the color of your
No change in the color.
okay, do you notice any change in the color of your eyes?
No,
Do you have any trauma in your tummy?
no,
Okay, do you have any mouth ulcer?
no.
Okay, do you have any back pain? Yes, you told me that you have the
I
pain
have
related
this
to your back.
radiated pain in my back.
Okay,
Yes,
do you mind if I ask you some questions about your past medical history?
can.
Okay, thank you. Is this happened for you before, or it's the first
No,
time?
first time, first time.
Okay, have you diagnosed with any other medical condition,
Like what?
like diabetes or hypertension?
No. Or high cholesterol? No.
Okay. Do you take any other medication, or do you have any allergy?
I allergic. What? Allergic to what?
Allergic to other any medications or any foods?
I am allergic to seafood.
Okay. Thank you for sharing this.
Mhm.
And do you have had any surgery before or admitted to the hospital?
No surgery, no admission before.
Okay. Thank you. Have this happened for your family? Any member of your family?
No, but my father died from heart attack.
I'm so sorry to hear this.
Okay.
Okay. And do you mind if I ask you some questions about your social history?
Okay, can.
Okay. What do you do for living?
I am retired teacher.
And with whom do you live with?
I live with my wife and two children.
Okay. Do you smoke?
Yes, I smoke 10 cigarettes per day for the last 50 years or 40 years.
Okay. And do you drink alcohol? That's the main
Yes, usually
cause.
in weekend, one can of alcoholic beer in the weekend.
Okay. Do you have any shortness of breath, any cough, any chest pain,
No.
any problem in water work, any problem in bowel work?
What you mean by water? Water work, what you mean?
When you go to the loo, do you have any problem in
You
your
mean the
urine?
urine, doctor?
Yes, you're.
Urine is English word, so I can understand it. So nothing in my urine. You mean to ask about frequency, change in color,
Yes.
or something like that is not okay.
Okay. Thank you for sharing
Okay.
us these details. Do you have any additional information do you want to add?
No.
Okay. Thank you very much, Doctor
Okay.
Mr. John. Thank you for sharing us this information.
All right. Finish. Okay. Thank you. So your time is okay. Management of time is okay. So we just show you some mistakes. So first, if you see in the script, so is mentioned that he's attended his daughter wedding. Okay.
Mm,
So what's
okay.
supposed to tell him? So we have something called the embassy and the history taking. So if the patient say, have attended my daughter wedding yesterday, so thank you, just to say congratulations or something like that. Okay.
Okay. Good.
All right.
Okay.
This is okay. All right. By the way, you take a history, you ask about the pain, you analyze the pain. When you ask about the pain, of course, you ask about character, what increase, what decrease, any radiation, any pain score, all these mentions is okay. You ask about change in urine is urine. If you, it is important to know we don't teach you slang English. So urine is urine. So
Okay.
it's like I think even in Arabic, if you speak, you ask the patient, "What about your urine?" So urine is urine, not water work. Okay,
Okay.
and just to go to water washroom is low is a slang also. They can go to washroom or toilet or whatever you can mention. If you ask about urine, you need to ask about frequency, dysuria, frequency, and change in color. All right. You ask about mouth ulcer. So why you ask about mouth ulcer?
IBD, extra intestinal manifestation.
Inflammatory bowel disease, you mean?
Yes.
Can, but this patient have no diarrhea. You ask about shoulder pain. So why you ask about this? And jaundice.
There is acute cholecystitis,
Okay,
maybe.
can is okay. Okay, because it is clear it is pancreatitis, but you can ask no problem. When you ask about other disease, you need to enumerate. hypertension, diabetes, and dyslipidemia.
Okay.
Uh, you give empathy when I tell you my father have a heart attack, so it is okay. You ask about smoking, you ask about alcohol, you ask about allergy. When you ask about allergy, you need to ask about allergy to food and medication. All right.
Okay.
You thank the patient a lot, so no need to thank the a lot. I think when you start the conversation, you need to give a patient painkiller or something like that. Of course, this is patient is actor, no problem. So now, what's your diagnosis?
I want to ask a question, please, before
Yes,
we leave this point. From STEM, it is clear that it is acute pancreatitis.
yes.
Okay.
You know
Uh,
that you know the station. Usually, 100% of the student know the station before they enter.
yes, I mean that in STEM, it is clear that he has gastric pain and radiating to the back and alcohol. So
Yes,
it's pure acute pancreatitis.
yes.
That's mean that I shouldn't ask about any differentials, or I should
Uh,
ask.
we ask you about differential, but if you need to ask, you can ask, no problem. But you
Okay.
can ask, no problem. All
Okay.
right, because usually pancreatitis can be associating with gallbladder stone and others. All right. So, what's your differential diagnosis?
My main differential diagnosis is acute pancreatitis.
What else can be differential diagnosis?
Maybe myocardial infarction,
No, no,
acute
no, no. We are from surgical point of view. It is not epigastric pain. Can be myocardial infarction. What else?
acute cholecystitis,
Acute cholecystitis. Okay. What is the difference between acute cholecystitis and acute cholangitis?
acute cholecystitis and acute cholangitis,
Yes.
uh, radiating to the right shoulder.
Non-radiated right shoulder can occur in both. Acute cholecystitis have
Yes,
fever and pain. Acute
yes.
cholangitis have fever and pain and
Jones.
jaundice. What we called it?
Yes, the triad.
Charcot-Triad. Okay.
Triad. Yes.
A blood investigation. Okay, of course, you take a history in 6 minutes. You have question in 3-4 minutes. What is the main investigation to confirm the diagnosis of the pancreatitis?
I should do amylase and lipase.
Amylase and lipase. All right. Okay. So, what other investigation you need to do?
I can do a cardiac enzyme to exclude MI, and
Can
I
do, but just to start, if you ask about lab investigation, you need to start by full blood count, by all these.
ABC, ESR,
Okay. So, you will
CRP.
do it or you will ask for that. You do it by yourself. You say, I do, I do. So, you do it.
Yes.
You understand the meaning.
Eh,
You do, I
I will
do,
request.
you ask or request or something. I do mean I do it. I do by myself. You understand?
Yes, I understand.
It is like I make a cake, so I make it by myself. Okay,
Y-
so you will ask for full blood count, urea, all this. What else you need to ask about?
I will do ultrasound and
No, no, no. It's still in lab investigation. What else you need?
blood.
You
Uh,
ask for blood sugar, for example.
yes,
You
yes,
ask for
and
calcium,
ABG, ABG.
arterial blood gases, all
Oh,
this.
yes.
Okay. We ask you later. So why you ask for blood sugar?
Uh,
Okay.
in,
If the patient is non-diabetic and the blood sugar is high, it is confirmed diagnosis. Right?
it is tumor called
No, 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 not tumor. What you need to tell me?
but if the patient has what? Again, the question?
Have blood sugar, high blood sugar. What indicate?
Yes.
And he's not diabetic.
Insulinoma, maybe.
No, 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 not necessary.
Insulinoma,
It is
low blood.
doctor, don't be so clever. It is the easy way to fail. This is just one of criteria. If the patient have high blood sugar and he's non-diabetic, it is indicated confirmed diagnosis of pancreatitis. We see it in the Glasgow criteria. So, what is the etiology of this pancreatitis in general?
The etiology of
What is the cause
pancreatitis,
of pancreatitis? Yes,
alcohol,
alcohol. What else? Not in this patient in general.
maybe, and stones.
You mean gallbladder stones?
Yes.
All right. Okay. So this is a CT scan of liver. and show this area of pancreas. So can you comment in this area?
Which one again?
They have two arrows here. You see the arrows.
Yes.
So just what your comment? Just in one word, two word.
This pancreas.
Yeah, it is normal. If you this is the normal pancreas, very
Yes.
thin. So this is what happened to the pancreas. Become bigger, edematous, something like that. Okay,
Yes.
just enlarge
Okay.
it. All right. So any scoring you can use it to diagnose the severity of this pancreatitis.
Glasgow score.
Okay, so what is this Glasgow score?
It's has some criteria like I see oxygen is less than 8 and
Okay,
age
so
more
just write in paper PANCR all these words. So is P for PO2? What is E for age? More than
more than 50.
55. N for
Neutrophils more than 15.
and no number, just high, just tell high. What is about calcium?
Okay. And low calcium.
What about renal function?
High urea
Liver
high.
enzyme
Liver enzymes will be
high,
low, high. Yes.
and the acidosis
And,
mean low pH and high blood sugar. How to
yes.
treat this patient? Acute
Uh,
pancreatitis.
according to CRIS protocol,
So what do
admission,
you mean by CRISPR protocol?
ABCD approach.
No, what is APC? What is CRISPR protocol?
It is he is critically ill surgical
Uh,
patient.
why you consider this patient is critically ill?
Has severe pain.
Severe pain is not mean critically ill. It is from the slang. It is ill mean have a pain, but critical ill patients must have criteria. So this is not critical ill patient, doctor. Okay,
And
it is just a patient. It's not an ICU. You can admit him in ICU under certain criteria, but it is not a critical ill patient.
okay, should
All right.
so I shouldn't mention CRIS protocol.
No, you can mention, no problem. But
Okay,
how to treat it, you don't tell me.
okay.
How to treat it.
I admission to HDU and give him analgesia and IV fluid and oxygen.
Analgesia, IV fluid, and oxygen. Why you give him
Oxygen.
oxygen? I agree, but why?
Uh, because due to the pain, maybe have shortness of breath.
Okay, so what is the complication in pancreatitis affect the lung?
Uh,
ARDS, adult respiratory
yes.
distress syndrome. So this is why you give oxygen. So you give analgesia, intravenous fluid. You can admit it in ICU or HDU. Okay, you put a catheter
Yes.
and monitor the fluid. All right.
Okay.
Okay. So it is okay. No problems. Anyone need to ask or any comment? Any comment from you, Dr. Fadi?
No, thanks.
Okay. All right. Not all the patient, by the way, is critical ill patients, but it is patient, some indication. Not all patient with pancreatitis admitted to ICU can be admitted in HDU, can be admitted in ICU, can be admitted in the ward according to oxygen saturation and how to manage. All right. So we
Yeah.
have the same scenario also, but at this time we have this patient is complain of the yellow discoloration of sclera and his eye, and we ask you to take a history. So anyone apart from Dr. Fadi, thank you, Dr. Fadi, just
Thank you.
take me a history. So this patient have abdominal pain and have yellow color of sclera and body. Anyone? So Dr. Aya, okay, Dr. Aya, you can start. Yeah, you can open the camera, not the camera, the mic, just I hear you. Okay. The Dr. Aya, I hear you. You can open the mic and you can start take a history if you wish. Or you can start if you need to ask a question.
آه، أنا
Hello.
ميدو
Salam
ميدو
alaikum.
دكتور
Yes.
السلام ورحمة الله وبركاته
You raise
okay.
your hand, so you have something to
Yeah.
ask. Okay, so what you need to ask?
No, I want to participate. Okay.
Okay, can. Okay, you can start.
Okay. This will be the same station of acute pancreatitis, right?
Say again.
This will be the same station as acute pancreatitis, right?
It is another stations. In each scenario, we have many script.
Mm. Okay.
So it is yellow
Uh,
discoloration. The patient have this 45 years old woman and have yellow discolor of her eye and abdomen.
okay. Um, hello, I'm
Hello.
Dr. Aya, one of the exam candidates. May I
Yes.
confirm your name and age, please?
Because this is female, so I am Miss Sarah, and I am 45 years old.
Okay.
Miss
Hello, Ms.
Sarah.
Sarah. Nice to meet you.
Okay, thank you.
Today I have been asked to ask you few questions regarding your condition. Is that okay
Yeah.
with you?
Yes, can.
Okay. What seemed to be your problem, Ms. Sarah?
No, I have just yellow discoloration and abdominal pain.
Oh, I'm sorry to hear that. Do you need any painkiller?
No, I'm already in hospital. They give me.
Okay. Um, could you tell me, please, where is your pain?
It is pain is start in my upper part of my abdomen, and now is in the right upper part, right side of my abdomen.
Okay, I'm sorry to hear that. We will do our best to help you. So when did this pain start?
Yesterday, I was invited for the lunch, for the dinner in my neighbors, and when I eat, I feel this pain.
Okay, did this pain start suddenly or gradually?
No, it is sudden.
Okay. Can you describe this pain for me? Is it colicky or crushing pain or cramping pain?
It is colic in nature, so it is intermittent pain.
Okay, I'm sorry to hear that. Does this pain move anywhere?
It is radiated to my right shoulder.
Okay. Is this pain with you all the time or it comes and goes?
It comes and goes.
Okay. Uh, is there anything worsening the pain or making it better?
If I eat, I try to eat again, the pain is increasing.
Oh, I'm sorry to hear that. We'll try our best to help you. So, can you describe the pain from 1 to 10, 1 being the lowest, 10 being the highest?
Okay, it is when it started, it is 7, now it's 3.
Okay, okay, I'm sorry to hear that. Um, so, is there any signs of chest pain with you or shortness of breath?
No chest pain, no shortening of breath.
Okay. Is this pain radiating to your back?
No, it is radiated to my right shoulder.
Okay. Does it decrease when you lean forward?
No,
Okay. Um, is there any heartburn?
no.
Okay. Um, does your pain increase with fatty meals?
Yes, it is increased with fatty meal. I usually like fried food.
Okay. Do you have any fever?
Yes, I have fever. The nurse measures the temperature is 38.5.
Oh, okay. I'm sorry to hear that.
Okay.
Um, is there any change in the color of your urine or stool?
Urine has become darker. It is tea color, and my stool, I don't notice it.
Okay. Is there any discoloration of in your eye?
Yes, my husband noticed that my eye is clearer and my body is turning yellow.
Oh, I'm sorry to hear that.
Okay.
Do you have any history of trauma or trauma to your tummy?
No.
Okay. Is there any pain in your eyes?
What I don't understand. You mean glaucoma or something like that, or what?
Does your eye hurt?
No.
Okay. Do you have any skin problems?
Like what?
Like discoloration of your skin or redness or something like this?
No, it is yellow, just yellow.
Okay. Do you have any back pain or joint pain?
No.
Okay. Do you have any past medical history or surgical history?
What you mean by surgical history?
Did you perform any kind of operation in the past?
No surgery admission. No admission for surgery. I just admitted for the normal vaginal delivery. 4 times.
Oh, okay.
Okay, thank
Okay.
you.
Do you have any previous episodes of symptoms like this before in the past?
No, first time.
Okay. Do you take any kind of medications?
No.
Do you have any allergy from any drugs?
No, allergic to seafood.
Okay. Is there any family history? Did anyone in your family suffer from such symptoms before?
No, but my father died from cancer colon.
Oh, I'm sorry to hear that.
Thank you.
Um, so can you tell me what's your job?
No, I am a housewife.
Okay. Where do you live?
I live with my husband and 4 children.
Okay. Do you smoke?
I smoke 10 cigarettes per day for the last 20 years.
Okay. Do you drink any alcohol?
Occasionally in weekend, I drink one alcoholic beer.
Okay. So can you tell me what you think the cause for your symptoms is?
I don't have much knowledge in medicines, but can maybe worm, maybe parasite. I don't know.
Okay. Is there anything you are concerned about?
What you mean by concern?
Something that you think is the cause of your symptoms and you are afraid
I
it will
think
be this
this is
cause?
some rare worm in my country. I think. Okay.
Okay. So what do you hope from us, Miss Sarah?
I don't know. I came to take a medication. I don't know much in medicine, so I just need to take a medication or
Of
to
course
remove
we will
my
try
head.
our
Yeah.
of course we will try our best to help you. So did you notice any weight loss recently?
No loss of weight.
No loss of your appetite?
No,
Any shortness of breath or cough?
no,
Oh, okay. Any muscle or joint pain?
no,
Okay. Is there anything else you want to add, Miss Sarah?
no. Thank you so much.
Okay, thank you very much.
Okay, thank you, Dr. Aya. All right. So we start
Mm.
by you. What you accept? You know how many times you say sorry? What I count to you. So how many times you say sorry?
وأنا بحاول أسوق empathy يعني.
Yes, but you make it 7 times. Okay, it is like to thank you, thank you, thank you. So it is not good. This is first.
Okay.
Second, what do you mean by pain in eye? I don't understand you.
يعني eye itching أو eye burning اللي هو بتاعة الأي بي دي حاجات أسئلة الأي بي دي
I what?
أي بي دي اللي هو irritable bowel
Irritable
disease.
bowel can use rhinosinusitis or this. I think is not causing pain. All right. Okay. And what do you
Right.
mean by skin? Also, ask about the skin.
برضه عشان الأي بي دي.
But you know that you suspect this patient is IBD.
هو احنا بنقول حبة question عشان ننفي مثلا حاجة عشان في النهاية في السمري نقول إن هو positive مثلا أكيد كوليسيستايتس
لا هي دي
وبرضه
بص
في
يا دكتورة it is not a good policy يعني انت بتعملي lost your time you ask some silly question. Of course you remember loss of weight, loss of appetite. I think the previous candidate not ask about this, so it is important. ICE, I just show you just our impression. In your practice, because Dr. Sarah, we treat you according to your background. The background means that from where you are graduated. You understand me first. Okay?
of course
So
okay
in your medical school, do you have this ICE? I don't know from where you are
no
graduated, but you're looking from Arab cultures or Arab background. So if this is teaching
Egypt
in your school,
Egypt
we accept it. If it is not in your background, so don't say something not in your background,
okay
especially if you examine. So this is ICE, and the way you're asking ICE is very, very distressing. It is it is make the actor angry. I think you entered the exam before or not.
لا first
If you
time
enter the exam and ask the patient these 3 questions in this way, I don't know what in Egypt, but if you ask the and you are in India, the actor shouting for you, shouting like become more aggressive, because we don't usually ask the patient what is your concern or what you expected from us to do. All right. So
تمام
what's
يعني
your
no
name?
ICE
Say again.
يعني we don't ask ICE
No,
in
no,
any
I want
station
to know your background, doctor, and where you examined. In some
Egypt
cultures, they can. We responsible for Southeast Asia, for example. I think some of you will come and exam in Sri Lanka or other place. They have we treat him different. But from your background, I think
Egypt
you don't teach like this. But if you teach it, okay, I agree. I don't know what is your background. Okay,
I don't
background
think
means that from where you are graduated, like from which college, which book you read, like Hampton Bailey, DAS, whatever. So this is your background. So what's your
Egypt.
diagnosis?
Acute cholecystitis,
No, I
main
don't agree.
diagnosis.
After all this question, I don't agree. It is not acute cholecystitis. What else can?
هو differential تبقى
Not
MI أو
differential.
acute
This patient have pain, have fever, have jaundice. So what it could be?
acute cholangitis.
Acute cholangitis. So this is ascending or acute cholangitis. Can be acute cholecystitis. So next question you expected, what is the difference between acute cholecystitis and acute cholangitis? What is the
اللي هو
difference?
الشاركوت ستريات
Charcot-Tret.
وال
So in acute cholecystitis, the patient have no jaundice. But
مم.
in this patients, they have jaundice. So this is have. Of course, if you need to ask some extra question, in jaundice, you can ask about bleeding tendency because jaundice can lack of vitamin K. All right.
مم.
So apart from this, what's the investigation you will do for this patient?
will دي CBC
Looking for.
ESR
No. CBC looking for. Looking for
مم.
leukocytosis.
yeah
In your
uh,
hospital, you work in general surgery, by the way, or not?
no
So suppose you are working in medicine or surgery, you do ECR or not? For all patients of gallbladder. Is this a diagnostic for anything or just for any infection?
inflammatory marker.
طب inflammatory marker, so you know that it is inflammation. It is give you a good idea. It help you in diagnosis.
It rule out the يعني
Okay, can. All right. Okay, what other investigation you need? What about liver function test? Which liver function test you need to do? Liver enzymes and bilirubin. So which bilirubin increase in obstructive jaundice? Direct or indirect?
direct.
Direct bilirubin. Okay. After that, for obstructive jaundice, if you have a stone in the common bile duct, how to remove it?
ACRV.
You mean ERCB?
ERCB, yeah.
ERCB, endoscopic retrograde cholangiopancreatography, and usually something like this to remove the stone. If difficult to remove the stone, we put a stent. Okay, before we make ERCB, what other radiological investigation you need to do?
CT and ultrasound.
So can choose one, CT or ultrasound?
CT.
Okay, I think what is the routine? Usually we start by abdominal ultrasound, looking for the stone, looking for the confirm the stone, and looking for the common bile duct. But if this if the patient have loss of weight and patient is old and we expected that have CA, pancreas or something like that, so it's better to also add CT. Okay.
Okay.
All right.
Okay.
Thank you, Dr. Aya. Well done.
Thank you so much, doctor. Thank you.
No problem.
But
Don't say much. Sorry.
Okay.
Okay.
I just want to confirm in Egypt,
Yes.
in Cairo, that will be my exam. ICE, should I ask it or not?
I don't know what's the background where we are graduated, but I think from Egyptian background,
Cairo.
I am organizer for the Egypt for more than 10 years. We don't ask this.
Okay. Okay.
All right. Okay. It is if something is you don't done in your college, so you don't do it is in the Royal College.
Okay. Okay.
All right.
Okay,
For history taking, it is the same all over the world. It's the same all over Egypt, except some doctor graduated from Masr or 6 October. They have the habit, they put the hypertension, diabetes in the first with presentation. It is correct if you present a case report. But for history, you take it at the end. Anyone have a question? Because I found some raised the hands. Anyone have a question? Another Aya or these two Aya Rida, you ask something or what?
لا هو أنا بس يعني عايزة أشارك
Okay,
لو
can.
متاح
So
يعني.
the third scenario is also the same, I think is abdominal pain and some different, but still in abdominal pain. So 35 years old woman complaining of abdominal pain and bloody diarrhea. Okay? So
Okay.
you can start.
Good afternoon. I am Dr. Aya, one of the surgical doctor. Can I confirm your name and age, please?
Yes, I am Miss Sarah. I'm 35 years old.
Nice to meet you, Miss Sarah. Can I call you Sarah?
Can.
Okay, please can you tell me what is your problem today?
Yeah, you know that for the last 10 years, I have sometimes abdominal pain and bloody diarrhea.
I am so sorry for that.
Thank you.
Can you take more about your complaint?
Okay, you can ask which one you need to ask, is abdominal pain or diarrhea?
Start by abdominal pain, please.
Okay, I have abdominal pain for the last 10 years. It is, you can ask me, I tell you.
Okay, can you tell me which side in your
No, it
tummy
is
have this
generalized
pain?
abdominal pain and it's colicky in nature.
Colicky in nature. It is start sudden or gradual?
No, it is gradual for the last 10 years.
For something increase it and or something decrease it?
No, it is just sometimes if I eat, the pain increase. Sometimes if I don't eat, the pain decrease.
What about stress?
Yes, also stress can increase the pain.
Okay. Can you take more about this pain radiating to anything anywhere
No, it
in
is
your body
generalized
or?
pain, not radiated.
Okay. What is the character of this pain?
It is dull aching, sometimes colicky, sometimes.
Okay. Can you now describe your bloody diarrhea?
Bloody diarrhea is intermittent and some diarrhea and the mucus.
Mucus?
Yes.
Do you have any unintentional weight loss?
No, but I is little loss of weight. I don't gain much weight, but not like 1 kilo every 2-3 months, something like that.
Okay. I see that. Okay. Do you have bloody diarrhea? Do you have any problem rather than this bloody diarrhea and the pain?
Like what?
Nausea, vomiting.
No, but I have joint pain.
I have joint pain.
Yes.
Okay. Do you have any constipation sometime?
No.
No. Okay. Do you have any eye complaint?
Yes, I have something called inflammation of iris, and I follow up in eye clinic.
Okay, I see that.
Mhm.
Okay, Mrs. Sarah. Do you have any medical problem like diabetes or hypertension?
No,
Okay. Do you have any previous surgery?
no,
Do you have any allergy for any food or medication?
no allergy.
Okay, nice. Okay, Miss Sarah, do you have any one in your family have the same problem?
Yeah, no.
Okay. Can I ask you some question like do you smoke?
Yes, I smoke 10 cigarettes per day for the last 5 years.
Okay. What about alcohol?
I drink alcohol in weekend, one alcoholic beer.
Okay. Do you have any increase in your heart beat recently?
No,
Do you have any shaky hands?
what you mean by shaky hand? Fine tremor, you mean?
Like yes.
No fine tremor.
Okay. Do you have any problem in your breathing?
No.
Okay, thank you, Ms. Sarah. I will take with my consultant and come to you again.
All right, thank you. What's your
Thank you.
diagnosis?
My diagnosis is irritable bowel syndrome.
Irritable bowel disease is usually
Disease.
if you what's called, if you don't have any disease, so they say it is irritable bowel disease.
Bowel disease. Oh, sorry.
It is not irritable bowel disease. You know, if you remember your friend, they ask about joint pain and the eye. So why you ask about joint and eye? And this is British lady or British girl. So what it could be common in England? Not irritable, but it is eye also. It is inflammatory bowel disease. You agree?
Yes.
So it is inflammatory bowel disease like Crohn's, can be related to the stress sometimes. So what is the investigation you will do for this patient?
I will order fecal calprotectin
Okay, so you
and
start, doctor, you start first by full blood count, by baseline investigation. After that, the more specific is fecal cal protecting. But when you ask, you don't order, you work in army or what? So you
no,
will ask order if you work in army, I
I
think.
will ask.
Yes.
Okay.
Okay, so that just you need to start by baseline investigation, followed by C-reactive protein or inflammatory marker or fecal calci protein. What else you need to do?
After that, I will ask for colonoscopy or CT with oral and IV contrast.
No, just one by one. Colonoscopy, I agree. Upper endoscopy can agree. What you mentioned again, last one is?
CT with oral and IV contrast.
You mean like in IV, okay. Or what you mean by oral? Barium swallow and all this?
Yes,
It is done nowadays in your hospital or not done?
yes،
Are you
يوميا.
sure? Yes?
اه بنعملها كل يوم. ده احنا
Barium
بنديله
swallow.
صبغة اورال، بنديله الصبغة اورال واي في وبنصوره في تو فيز.
Where you are working?
القصر العيني.
All right. Okay. But I think, okay, can. But usually oral is not. You can ask Dr. Dua, maybe no more than me. Okay. All right. No problem. If you do it, no problem. So this is a picture of colonoscope. So you can find just the Crohn's is affect which layer of the intestine.
الكرونز or all layer.
Okay. So is the fistula is common with Crohn's or with ulcerative colitis?
with Crohn's.
Yes. All right. Okay. Okay. Thank you. So again, we usually barium enema is not done. Maybe if he have experience in the barium swallow in Crohn's, can maybe Crohn's is rare in Egypt, but it's common in England, and they can use capsule for to see it or endoscope or colonoscopes, no problem. Okay. Anyone have a question, by the way, before we go to the next scenario?
معلش يا دكتور شيرين، ممكن بس
Yes.
تقولي كومنت انا خلصت في قد ايه وخلصت كل
لا
الاسئله
كويس،
ولا لا؟
يور performance كويس، بس اي ثينك اتخضيتي من السيناريو او حاجه زي كده. هو طبعا it is important to know whatever if the topics is not, we have a history taken in topic not related to surgery at all, like tonsillar disease or anxiety, but again it is not history taken to reach the diagnosis. It is history taken to test your item in the history, which is social history, family history, allergy, systematic review, admission to surgery, all this. So you have a good, because the scenario have no much complaint. But of course, you need to ask in detail about other systematic review like UTI, urinary tract infection, urinary problem. You ask about diarrhea, constipation. You ask about palpitation. Okay. So something like that. So it's not much related. You can ask about backache. Sometimes it is extra-intestinal manifestations. The patient have ankylosing spondylitis or something like that. But is overall is accepted.
Thank you. Thank you.
Okay. So the next scenario, and it is common also, come either for sometimes history taking, sometimes for another's. It is lower pain. Ischemia. Okay, so we have this scenario: is 65 years old man in outpatient clinic, complain of pain in the left lower limb after walking. So anyone need to share? Okay. So Tawfiq, Abdullah Saad. So two rises. So start by Tawfiq. After that, Dr. Abdullah in the next scenario. Dr. Tawfiq, you can start.
Okay, doctor.
Okay.
Wait,
before I start, I think one of the doctors, I don't know which ayah, he say hello. I think the last ayah. Okay. Dr. Aya, when you start
أنا
conversation, don't say hello, just good
أنا
morning.
قلت
Hello.
good afternoon
You
لأن أنا
may
امتحاني الساعة 12.
all right, okay, whatever, but whatever you are, don't say hi or hello. Can you do it in your friend? Okay, Tawfiq, you can
Okay.
start. Good morning or good evening, whatever. Hello?
Good evening. I am Tawfiq, one of the exam candidates. May I confirm your name and age, please?
Yes, I am Mr. John. I am 65 years old.
Hello, Mr. Jones. What seems to be problem today?
Yes, I have pain in my left lower limb when I'm walking.
Oh, I'm really sorry for that. Since what it started?
Last week,
Since
usually
when?
I walking around my house. So after I walking for 1 kilo, I have severe pain in my lower limb.
I'm really sorry for that. Did it start suddenly or gradually?
No, it is suddenly, and I need to stop for walking for 5 minutes. After that, it is improved.
5 minutes, yeah. Can you describe me the pain? Does it colicky, stabbing,
No, it
or
is cramping pain.
camping pain? Yeah. Does it radiate elsewhere?
No, not radiate.
No radiation. Is it related to a specific time?
No, it is after walking for 1 kilo or about 20 minutes.
Okay. Now, could you tell me if the pain related to hot or cold weather?
No, not related to the.
Okay. Does it related to walking few much or related to rest?
No, it is if I walk, I have the pain. I need to stop.
Hmm,
After that, I can walk again, and after that, I
hmm.
need to stop again. So
Okay.
it is
Do you have
intermittent.
any? Yeah. Do you have any inability to walk upstairs?
No.
Okay. Could you tell me how far you can walk and stop suddenly due to pain?
It is for 1 kilo,
1 kilo. Yeah. Do you
one,
have pain?
1 kilometer.
1 kilo. Yeah. Do you have pain while rest?
No.
Okay. Does the pain affect your daily routine,
What you mean by daily routine?
daily activities
No, no.
while you're
I
working?
am retired teacher, so I just read the newspaper.
Okay. Did you notice any breach like in your foot or legs?
You mean that wound? No.
Yeah, wound. Yeah. Did you notice? Do you feel any coldness in your legs?
Yes, it is the left leg is colder than compared to the right leg.
I'm really sorry for that. Did you notice any back pain, back trauma, something like that?
Back pain, not back what?
Back pain. Did you have any back trauma or back pain?
No trauma, no back pain.
Okay. Did you notice any weakness or numbness in your lower limbs?
I have no weakness, but I think the sensation is less compared to the other side.
I'm really sorry for that. Did you have any other medical conditions like diabetes, hypertension, hyperlipidemia, or something
I,
like
I,
this?
I don't have diabetes, but I have hypertension and I have hyperlipidemia or dyslipidemia.
I'm really sorry for that. Do you have any cardiovascular diseases?
Uh, no, but no. If you consider the hypertension is cardiovascular disease, it is cardiovascular disease.
Okay, I'm really sorry for that. Did you have any previous surgeries?
No surgery.
Okay. Can you tell me what is your occupation, please?
I am a retired teacher. I teach
Yeah.
English.
Okay. Who do you live with you at home?
My wife is died many years ago, so I live alone.
No, I'm really sorry for that.
Okay.
Do you smoke?
Yeah, I smoke 10 cigarettes per day for the last 50 years.
Do you drink alcohol?
I drink 1 can of alcoholic beer every weekend.
Mm, Okay. Do you have any shortness of breathing,
No,
chest pain?
no,
Do you have muscle pain,
no,
joint pains, or bony pains?
no,
Do you have any difficulty while passing urine?
no,
Do you have any difficulty while swallowing, diarrhea, or constipation, something like that?
no.
Okay, sorry. Okay, sir. Thank you for that. you have any other questions you want to ask me?
No, but you don't ask about allergy. It is important.
Okay. Do you have any? Do you take any medications?
No, I am allergic to seafood.
You have an
But
allergy? Okay. Understood.
what's your diagnosis?
My diagnosis is vascular disease or chronic limb ischemia, peripheral vascular disease.
Peripheral vascular
Uh,
disease. So in peripheral vascular disease, if you examine the patient, so what you
hmm.
look first in the patient leg?
I look first for full peripheral vascular examination. I look for any coldness, any ulcers, any bluish discoloration, and I will do a full
No,
logical
it's still in
examination.
the skin manifestation. What else you need to ask in the you see in the skin manifestation? If I show
Is
you,
there
for
is
example, leg of
hmm,
someone with ischemia,
hmm.
like
Is there
this.
is any bluish, yeah,
Okay,
bluish
what else? No,
discoloration
no,
or
something
ulcers?
very important, easy to be picked
Trophic
in
change.
early. What?
Trophic change.
What else? More easy to
Uh,
be picked.
discoloration,
Anyone say again?
discoloration, and trophic change.
No, something more
Coldness,
easier. Yes,
coldness,
can be called loss of hair. Okay,
I
so we're
said the
back
trophic
again.
change. Okay, okay.
Okay, after introduce yourself and all this. So first, the first manifestation in ischemic patient is loss of hair. Skin change, you ask. Any wound or
Hmm,
ulcer, you mention cracking. Any infection between toes. Of course, this intermittent claudication. You ask
hmm,
about muscle, you ask about sensation, you ask about temperature. So why you
hmm.
ask about if you walk uphill, what you looking for? Spinal canal stenosis?
Uh, spinal canal stenosis improve while walking downhill.
Yes.
Uh,
Okay. So
and
this is why
this
you
is
ask about this.
yes,
Okay.
that's included.
Yes, you tell a lot of very sorry, but you tell very sorry when I tell my wife died, so it is okay. So you
Okay.
mentioned that you ask about all this. So what's your diagnosis again, and what is the investigation you
Uh,
will do?
my initial diagnosis is chronic limb ischemia, peripheral vascular disease.
No, it is right
I
side or left side. It is left lower limb
It is the left
ischemia.
side, left
Left
side lower limb
side.
ischemia.
So what
Yeah.
investigation you need to do?
Investigation first. I will do full peripheral vascular
No,
examination.
doctor. Investigation start by lab investigation, full
Okay,
blood count,
full
blood
blood
cholesterol,
counts.
all this. By the way,
I mean, okay.
what you mean? Yes.
I mean, I have to do my full neurological examination and ask for labs after that.
Neurological or vascular examination.
Neurological and cardiovascular.
Make it vascular easy, okay? So you make vascular
Okay.
examination. After that, you ask about investigation. So what
Yes.
investigation you will do?
Full blood count, liver function tests, full fasting blood sugar. Uh, I will monitor the blood pressure as he is and cholesterol, LDH, and HDL to monitor the patient medical
Okay,
diseases.
so of
And
course,
patient
in
conditions.
clinical examination, you do ankle brachial index, and by handhold Doppler, you're looking for pulsation. So what further investigation? If you found the lower or peripheral pulsation is weak, what else you need to do?
I will do arterial duplex. I will do. I will order to CT angio or maybe MR
What you
angio,
mean by CT angio? It is
CT
for
angiography.
which area of the body?
For which area? For the lower limb, for the left side,
For the lower limb, just angio, not
for
CT.
the
CT
lower.
angio can feel for abdomen. So you make something like this. What you comment on this picture?
There is ischemia, this lower limb ischemia, left side.
Which limb, left side, which artery
Yeah,
is occluded?
I think it's a popliteal, popliteal
This
artery.
is the end of femoral and the beginning of popliteal. Is this patient, it is from this picture, it is still viable limb or not?
Yeah, I think it's still viable limb.
Why? Yes, I agree, but why?
There is no traffic
Because they have
changes.
collateral. Okay, so
Yeah, I have collateral.
how to manage this patient?
How to manage this patient? First, I will optimize the blood sugar, cholesterol, and the
No,
hypertensive.
after preparations, how to manage surgically? or
Okay,
vascular.
surgically, endovascular stenting or
Okay.
surgical bypass.
No. Just choose. We don't give me option. So it is
Okay, I will start with
endovascular
stenting.
stenting or
Hmm.
bypass.
Stenting, yeah.
Bypass is
In
not
this case,
common, so stenting. But how to stent? You need to remove the thrombus or embolus before stenting. So you make embolectomy followed by stent. Okay, or you
okay,
can make
okay,
embolectomy followed by balloon dilatation and then stent.
okay,
Okay,
okay.
so it is easy station. Of course, in some cases, we make CT angio looking for to exclude any aortic aneurysm or any aortic injury, because sometimes the
Hmm.
aortic aneurysm associating with popliteal artery aneurysm. Okay.
Okay.
All right. So well done. Good. You
This
also
doctor, I want to ask.
very sorry. What?
I want to ask a question about the last of the previous station, which was IBD.
Yes.
Should we ask about the mucus and say mucus secretion, or use any other native word? Is the
Uh,
mucus is a native word?
actually, English is different from area to area. And
Mm.
what word they use it, like water work and all this, is not common used by British.
No, I mean maybe use a slime material or
You know
slimy.
that I tell you, in medical term, what use it? It is the English word, except some medical term like cardiac. Cardiac is a Latin word. But if you
Mm.
say anyone respiratory or intestine, he will understand it. I think if you have any of your friend child in secondary school or primary school in your country,
Mm.
and you ask him
Mm.
about stool and diarrhea and the mucus, he understand you.
Mm. Yes,
So don't be so
yes.
clever. We don't teach you how to speak slang English. It's not your job.
Okay, doctor. I'm afraid from the native examiner,
What you mean by native examiner?
from the layer man, the layer examiner, the
The
layman
lay
examiner.
examiner, he's no English, of course, and this is English. You expected the British lady. He don't know is urine is a English word. He don't know urine.
No, I don't mean urine. I do just mucus.
Mucus is also well
Um,
known. It is look mucus and all this.
okay, we'll
All
use
right.
it. Okay,
Don't be
okay,
so
doctor.
clever. This is to be so clever is the main cause of the failure in your centers.
ربنا
Dr.
يستر.
Abdullah
Okay, doctor.
Saad, are you ready?
Yes, doctor, ready.
Okay.
انا عندي سؤال بس معلش قبل
Okay.
ما
You
نبدا.
can ask
باي
Dr.
ذا واي
Muhammad.
يعني in examination flex and extend it's English or lay about يعني
No, it
layman
is
or
English. English is English, doctor.
flex extend it's okay.
If you have any of your brothers or sister in the primary school in Egypt, they know all this word. If you teach a sign in English, so if you suppose you are teaching in primary school science, so what you called it?
Bend straight.
No, they can't call it. You know that
Flex extend
the
okay.
Egyptian candidate is need to be more English than British. This is word is well known.
Okay.
Apart from some Latin word use it in medicine like cardiac, as I mentioned, but others is the same. It is an English word. Okay.
Excuse me, doctor.
Yes.
Okay, thank you, Professor.
Is the name anus is English word, by the
Yes,
way?
it's an English word, by the way. But if you need to
Okay,
think
okay,
bad package, you know that we don't teach you in English. We teach you this
okay,
is the station. We teach you your attitude, way of
okay,
talking. Next
okay,
time I show you what is your attitude. So we
okay,
have
doctor.
last scenario will be bleeding per rectum and alter bowel habit. Okay, it's very common disease in England. I think Dr. Abdullah is ready. If you are ready, so I just share the screen. So it is supposed to be old. So it is how old is 65 years old man attend an outpatient clinic complain of altered bowel habit. So take a history.
Okay.
Mhm.
Good evening. I'm Dr. Abdullah Salim, one of the exam candidates. May I
Yes.
confirm your name and age, please?
Yeah, I am Mr. John. I am 65 years old.
Nice to meet you, Mr. John. Today I have been asked to ask you some questions regarding your condition. Is that okay with you?
Yes, can.
Okay. How can I help you today?
No, I have just altered bowel habit. It's constipation and diarrhea.
I'm really sorry to hear this. This must be challenging.
Not
Could
challenging
you please
at all.
tell?
Not challenging. Don't the doctor say sorry and not challenging. This is word is not empathy at all. It is like you make a movie. Okay, we are not in movie. It is important to know in exam you are in the real way, like you speak in patient in your country. Okay, so don't be exaggerated. We don't make an acting. It is not an acting station. Although the actor is actor, he take money for that, but you're supposed to be a doctor. All right, no problem. Thank you for your empathy. Next.
Okay. Can you please tell me when did this start?
No, it is last 2 months. I have sometimes constipation, sometimes diarrhea.
Okay. Did it start suddenly or gradually?
No, it is gradually. So sometimes I have constipation. I go to washroom or toilet once every 2 days, and after that, in some days I go to toilet is 5 times per day.
Is this condition decreasing or increasing?
No, it is alternative. So it is sometimes constipation, sometimes diarrhea. So it is alternative.
Okay. Have you noticed any blood in your stool?
Yes, my stool's color is become darker. It's not actually not a fresh blood. It is stool mixed with blood.
Okay. Any blood clots?
No blood clots.
Okay. Do you have any decrease in your appetite?
No.
Any unintentional weight loss?
Yes, I lost 5 kilos in the last 1 month.
Okay. Any fever?
No fever.
Any night sweats?
No night sweats.
Any tummy pain during passing stool?
No abdominal pain.
Have you noticed any slime discharge in your stool?
No.
Any back pain?
No back pain.
Any joint, any eye changes?
No eye change, no joint pain.
Any skin changes?
What you mean by skin change?
Any skin manifestation change in
No.
your skin?
No.
Okay. Have you noticed any bleeding from other sides of your body?
No.
Have you noticed any swelling at your anus?
No.
Any vomiting?
No vomiting.
Any heartburn?
No.
Any acid taste at the back of your throat?
No.
Okay. Do you have urge to pass a stool despite passing little amount?
No.
Okay. Did you have any previous episodes for this condition?
No.
Do you visit your GP for any other medical problems?
No, just routine checkup.
Okay. You don't have any chronic diseases like diabetes, hypertension, hyperbilinemia?
No.
Have you done any surgical operations before?
No.
Have you investigated for this problem?
Yes, they will ask me to do investigation. The doctor ask you about that.
Okay. Are you taking any blood thinners?
What you mean by blood thinner? You mean aspirin?
Yes.
No, I don't take aspirin.
Okay. Do you take any medication?
No.
Do you have any allergy against any drug or against any medication or food?
I allergic to seafood.
Okay. There's any family history had a similar problem before?
My grandmother died from cancer colon.
I'm really sorry to hear that.
Okay, thank
May
you.
I ask you some personal questions?
Can.
What's your occupation?
I am a retired teacher.
With whom do you live?
I live with my wife.
Okay. Do you smoke?
Yeah, I smoke 10 cigarettes per day for the last 50 years.
Do you drink alcohol?
Yes, I drink 1 alcoholic beer every day.
Okay. Do you have any difficulty in swallowing?
In what?
Any difficulty in swallowing?
No,
Any shortness of breath?
no,
Any chest pain?
no,
Any muscle or joint pain?
no.
Okay, do you want to ask me about anything?
No, thank you so much.
Thank you.
What's your diagnosis?
Colon cancer?
Say again.
Colon cancer?
Cancer colon. Okay. Just need to ask you why you ask about not sweating.
Manifestations of malignancy, night sweats and fever and loss of appetite.
So
And
no.
and
Just a minute. Why you ask about fever? It's correct to ask about fever, but you ask about fever in colonic case, not for cancer. It is to differentiate between cancer and. If I said to you, I have fever and do not loss of weight, what's your diagnosis?
Gastroenteritis.
No, gastroenteritis in India, but not in Britain. Diverticulitis. So this is question about fever. If this script is fever, not associating with loss of weight, loss of appetite, so most probably it is diverticulitis. And usually patients take fast food and all this. So it is a case of cancer colon. All right. So what other differential diagnosis in all the people for this?
Inflammatory bowel disease.
Inflammatory bowel disease, what else? Inflammatory bowel disease, not in all the people, it is in the younger, but it's okay. What else?
Bleeding tendency.
We mentioned diverticulitis, but you know angiodysplasia. What is this?
Angiodysplasia.
Angiodysplasia is one of the cause of rectal bleeding in all the people. It is just like hemangioma. It is vascular malformation. So it is easy, not a cancer, and can easily treated. It's called angiodysplasia. It's common in all the age. We also have a cancer colon. We have diverticulitis with sitting with fever and diagnosed by investigation. We can also have familial adenomatous polyposis, can turn malignant, or patient take anticoagulant. All right. So back to your diagnosis. What is the investigation we need to do?
Laboratory investigation. I can go for full blood count, urea and electrolyte, CRB and C-reactive protein, and ESR.
Doctor, again, is C-reactive protein and ESR can diagnose cancer?
No.
Okay, so why you do it? In your practice, you do it. Even Dr. Kasr Al-Aini, so in cancer or any inflammation like cholecystitis, you do inflammatory mediator?
Routine.
Routine, okay. I don't know, maybe if routine in your hospital, okay, no problem. What else? Any tumor marker?
Tumor marker.
Yes. After surgery, patient after remove the colon, what is the tumor marker? You need to follow up this patient.
Carcinogenic antigen?
Yeah, CEA is a tumor marker. All right. I just to show you the picture. It's not this patient. This picture, what is this picture for? Or this picture is better. This one.
Yep.
Say again?
Familial adenomatous polyposis?
No, familial polyposis is this one. This familial adenomatous polyposis. Polyp. This is diverticulosis. This is diverticulosis. This is tumor. Okay? This is polyp. All right. Okay. So how to stage cancer colon?
CT.
Okay, CT, thorax, abdomen, and pelvis. What is the TNM staging for cancer colon?
TNM staging for cancer colon.
Yes, or
T1
staging. Okay, T1, yes.
T1 if it invades the submucosa. T2 if it reaches the muscularis propria, and T3 if it
So usually in
reaches
exam we ask you, suppose this tumor invading nearby organ like urinary bladder, so it is T what?
T4.
T4.
Mm.
T4. Okay, so what is the common site of cancer colon?
Common site of cancer colon.
Right side,
Sigmoid.
left side. Sigmoid, so left side. So what surgery will do for him?
Hartmann's procedure.
Say again?
Hartmann.
What is this?
Will taking down under the anastomosis and bringing out the proximal endocolostomy, and
So
will do
it is
reanastomosis.
just you mean left hemicolectomy and colostomy.
Yes.
Okay. So what you mentioned first, just to be clear, what you mentioned first?
Hartmann procedure.
Say again.
Hartmann.
Hartmann procedure. So Hartmann procedure is not routine. Hartmann can be in diverticulitis, but usually in the cancer colon after preparation of the patients, and we remove the left colon, so left hemicolectomy is colostomy. But if the patient have diverticulitis or perforation or not prepared, so we can do Hartmann procedures. Okay. All right. So as you see, history taking is a simple station. What you need to take in the history taking, don't forget to ask about systematic system or other system or systematic review, allergy, social history, family history, past history, admission of surgery. Don't say a lot of sorry. Don't say hello or hi to the patient. You have empathy, but not much empathy. I see you that you are much empathy. Don't make like you acting. You like it is look, your attitude of some of you is like acting, like simulation. It is not an action. It is not a movies. You don't make a movie. All right. So we have two raised their hand, Dr. Reda and Dr. Abdullah. Dr. Abdullah, what you need to ask? Or you remove?
I raised the hand but لما كنت participate.
All right. Okay. So Doctor, any other one he raised his hand? Anyone need to ask anything?
I have a question.
Yes, Dr. Fadi.
After finishing in this station, after finishing the taking history,
Yes.
I present my case, or like you asked me.
Actually, in some station we ask you to present your case, but nowadays we don't present, and usually the examiner asks you some question. But what happened recently, because some students complain that they don't understand our language, especially most of the examiner are foreigner. So the actor also nowadays, he asks you the question. So the actor in some station, in some country nowadays, what doctor, what the investigation you will do for me? What is the next step? What is the name of operation? So nowadays, some of this station, because this actor usually is English professional from British Council of the local country, so they ask you the examiner question.
But if the examiner asked me to present my case, should I mention the negative signs or positive only?
Suppose you need to present this patient. So I have 65 years patients, and they have alter bowel habit, and they have dark color stool, and have unintentional loss of weight, and other system is normal. So I think is most probably it is a case of the cancer colon.
Okay, and if I didn't reach the diagnosis, this will lose a lot of mark or fail the station or not?
As you see before, this is a station have 8 mark about communications and professionalism, and all of the student, it is you need to be practical. From practical point of view, I think all of you know the stations and you know the scenario, and some of you is like dictating يعني بيسمع او حاجه زي كده. So this is the station is mainly how to communicate, how to present yourself. But the differential diagnosis is just 1 mark or 2 mark maximum.
Okay, thank you.
All right. So حد تاني رفع hand. محمد عبد الزهير. You need to ask. Okay. So next time we meet is supposed to be Friday, and it is the beginning of the first Ramadan, I think. But this is the time is okay for you in Ramadan?
Yes, sure.
Okay. All right, inshallah. So happy Ramadan and Ramadan Mubarak. I will
كل سنة.
finish now. So anyone need to ask anything?
Thank you.
ايوه يا دكتور مع حضرتك
Okay. دكتور محمد قول.
الامتحان اللي فات اما دخلت كانت في لجنه في الهيستوري، كانت البنت اللي كنت بسالها كانت طول اللجنه كده تفضل تقوم وتقعد تقوم وتقعد، قامت سايباني في وسط اللجنه وماشيه بعد يعني
طب
يا دوب
ليه؟
خلصت قامت سايباني.
عارف ليه ولا مش عارف ليه؟
لا مش عارف، انا بسال
ان
حضرتك.
انت first time to enter the exam.
يا
If you go to the exam syllabus, one of the exam scenarios or one of the exam syllabus will put you in stress. In Egypt, you examine in Egypt. In Egypt, the
معاك.
examiner will be shy to be put you in stress because they afraid you meet him later. So this is the job of actor. You understand the idea?
تمام.
انت فاهمني؟ يعني هي she put you in stress. Is this a station اكيد كانت بتاعه مثلا بريك باد نيوز or what is the station about?
كانت اللي هي انجوينال ابسس تقريبا، هيستوري.
Okay. So if the patient is standing, you need to stand and ask her to sit. So don't sit and the patient is standing.
لا احنا كنا بنتكلم وكنا يعني باخد منها الهيستوري، بس كل شويه تقوم وتقعد كده وتفضل تفرك وبتاع، بعد كده يا دوب خلصت قامت سايباني
ما
وجريت.
هي لما بتقوم what is your response؟
كنتش عارف بصراحه.
ما انت تقوم
انا
بقى
بعد
انت
اديها
تقوم
بقى.
تقف يعني. بس دي يعني كانت يعني ظاهر يعني مندمجه في التمثيل شويه. بس دي مش
اقف انا كمان.
على اساس ان هي
طبعا.
ادك يا دكتور.
هو انت في عيانه بتفضل واقفه بتفضل واقف، لو ما تقعدش غير لما هي تقعدها. هي دي في اسكس بتاعت الحوار، كانك مذيع بتستقبل يعني بتعمل برنامج، والراجل قابلته في الاول واقف بتفضل اقعد، هو قاعد انت بتقعد، هو بيقعد الاول.
هي بتاكت از ادكت يعني دكتور.
وات ايفر هي دي هو مين كوميونيكيشنز يعني. هي دي هي اللجنه. كانت اللجنه كانت ايه؟ ابسس.
انفكت سودوناريزم. انفكت
بس
سودوناريزم
هي ما
اكيد.
فيهاش اسئله كتير. هي ما فيهاش اسئله كتير، هي بقى بتعمل يعني some acting. يعني history is very some cases like tonsillitis or tonsillar abscess is just very little knowledge. So we don't have a time to discuss. هتسألها في ايه؟ بس ما هي الاكتور دي she pay money for that, so it must be look professional. She need to be star movies. اوكي so don't worry. يعني اهم حاجه ما تبقاش انت تتعصب لو هي قامت يعني. ماشي ان شاء الله. اوكي اي اسئله تانية؟
ايوه يا دكتور.
قول.
في الاول وانا ببدا الانترفيو في الاول خالص بعد جود مورنينج لازم اقول له I've been asked to ask you some question about your condition، ولا مش لازم اخش على طول على
والله هي انتوا بتقولوها هي up to you، مش هتفرق.
ما بتكلم على كده، اصل في ناس كتير بتقولها، انا ما كنتش بقولها لحضرتك، فانا مش عارف دي
عادي،
صح
عايز
ولا
تقولها مش عايز تقولها مش هتفرق، هي مش فارقه معايا. لكن انتوا هو في يعني بص، هو Egyptian candidate is unique. I examine the student. I am the oldest examiner in the college. Egyptian candidate have something unique, and they insisted that it is a good way of presentation, although they don't do that in their practice. Usually we tell that Egyptian have schizophrenia. he يعني هو بيتعامل مع العيان في العياده بطريقه، وبيتعامل مع العيانين في الامتحان بطريقه مختلفه. العالم كله بيتعاملوا مع العيان ذا سيم واي، هو في العياده زي في البرايفت زي في الامتحان. ما انت يعني في الفري عايز تقول له ماشي البرميشن، بالذات في الكوميونيكيشن سكيلز ممكن تقول له. في الهيستوري سيكينج هو عارف ان انت تاخد هيستوري، يعني هو جاي لك عياده هتكلمه يعني.
والوقت ضيق
يعني هي مش هتفرق. بس هي انتوا بتعملوا حاجات غريبه، ما احنا بنسيبها عادي ما فيش مشاكل، لكن اكسبتد يعني النصيحه يعني الحاجه اللي انت ما عملتهاش في كليه الطب في يور ميديكال سكول ما تعملهاش في الزماله، بنبقى مستغربينها يعني. غير كده ما فيش مشاكل. ماشي. اوكي بالتوفيق كده ان شاء الله، نشوفكم يوم الجمعه.
ان شاء
التوفيق.
الله.
السلام عليكم. شكرا يا دكتور محمد.
عليكم السلام.
السلام عليكم.
شكرا.
مع السلامه. مع السلامه.
شكرا.
سلام.